I'm Michelle Gnagey, and I am a board-certified lactation consultant, so an IBCLC, International Board-Certified Lactation Consultant. The American Academy of Breastfeeding Medicine recommends breastfeeding as long as the mother and child want to. The American Academy of Pediatrics recommends exclusive breastfeeding for 6 months, which means that a baby doesn't get any supplementation other than breast milk for the first 6 months. And at that point, that's when you would add supplementation in. Exclusive breastfeeding means that babies get breast milk only exclusively from the breast as long as they can. So it varies, again, for each mom depending on how long she can take off from work and what things she has to do as she goes back, how long a baby is exclusively breastfed. And that's different than exclusive breast milk feeding, which would be when she expresses and feeds her baby just breast milk, as well as nursing. Skin to skin is when a mom and baby are placed actually skin to skin. Baby will have on a diaper, mom will not have any clothes on her upper part of her body, and we're actually trying to get the baby to get as much skin in contact with the mother as possible. So usually baby's lying the lengthways on mom's chest, head up on her chest, body down between her breasts and onto her abdomen. Babies relax when their feet touch mom's abdomen and thighs, and they're able to completely and feel secure right in that position. Skin to skin helps the brain to finish its development phases. It helps neurons to close and actually for the brain to grow. So skin to skin is absolutely an imperative thing that we are just currently researching and finding out more about. So the big push is to get babies skin to skin as soon as possible after delivery, and to leave them skin to skin if you're breastfeeding until they feed. Allow them some sleep time away from mom, and then again back skin to skin until they get awake and nurse again, and you keep repeating that cycle until you've kind of got the whole breastfeeding dance, if you will, figured out. So skin to skin for every baby, absolutely an imperative thing and needs to be encouraged and promoted. They've discovered that 4 to 6 months down the road, babies that have spent time skin to skin with their mothers cry less, have less needs, can calm themselves better. And they're doing research now that says that these kids that were skin to skin with their mother have security as adults. They're more secure people. They end up in less trouble. There's a plethora of different things. So pretty amazing. There's things in breast milk that you'll never be able to put into formula, white blood cells, immunities, all of the things that will help your baby to overcome different disease processes, so many different things. And then for the mother, there's also benefits in that as well. Lower cancer, different kinds of cancers, lower chance for obesity, lower chance for developing diabetes herself. Some mothers are not able to breastfeed, and while the number statistic-wise is small for that, there are, again, a multitude of different options out there for her. Breast milk, her own breast milk, is going to be the very best for her baby. Second choice would be donor breast milk, given through a donor milk bank, and we have one in Columbus. Dayton Children's has a site where we can get donor milk and where you can also donate donor milk. So that would be your second option. Third would be a formula choice, and that will be based on what the pediatrician feels is best, based on family allergies, family history, all of those kinds of things. When a physician is going to choose a feeding method, there are multiple things that they look at. And while yes, you can go to the store and you can buy X generic formula, is that the right thing for your baby? So it's really something that you want to discuss with your pediatrician. If you can afford to do donor milk, or donor milk is the best option for your baby and they can write a prescription for it, it's like obtaining a prescription to get donor milk, and it is very expensive. But in some cases, especially low birth weight babies, babies that are having a lot of difficulties with allergies, it may be the best choice for your baby. Here at the Atrium, after a woman has delivered her baby, the labor and delivery nurses are great at helping you get started initially. So they will help you get your baby skin to skin, and they will help you with the initial latch. And then usually lactation comes on board somewhere later the day that you deliver, or it could be early in the next morning. So my job part of my job is to also see inpatients, which would be a daily visit to any woman who's had a baby and is breastfeeding, or if there's a mom who's formula feeding that has questions about breast care or what's going to happen. You know, I'm not breastfeeding my baby, so what can I expect? I certainly can go in and see those patients as well.